Hi, my name is Dr. Elie Ramly. I'm a Harvard-trained plastic and reconstructive surgeon here in Beverly Hills. Growing up, I grew up in a family that is very heavily influenced by medicine. So my father is a primary care physician, my mother is a pharmacist. And so I grew up exposed to medicine early on and exposed to the physician-patient relationship. Our house, our apartment, was facing the clinic. So we were essentially door to door with the clinic, with my dad's clinic. And it was very common for, somebody to show up at 2 a.m. with a sick family member knocking at the door. My dad would put on his robe, put on his stethoscope, and go see them in clinic. And he was on 24/7. And his patients had long-term relationships with it. Their entire family had relationships with my father throughout his career, and he cared for the community. And that heavily influenced my the way I see medicine and the type of medicine that I deliver. That one-on-one relationship, being present and available at all times, and delivering the absolute best care possible and following through to the end. During medical school, I first got interested in surgery and then in facial surgery when I had the chance to go on surgical missions for patients, for kids who have cleft lip and palate. And over the years, as I then progressed into surgical training and I did full training in general surgery, I realized that I really wanted to dedicate myself to the face. I felt through my interactions with patients how meaningful that area was, whether, these were patients who were affected by burns, trauma, cancer, or things that are more, just differences that they were born with. And that was really where I found my passion and the meaning that the face carries in every single one of our interactions on a daily basis and everything we do in real life, really. And even with normal anatomy, the face has such meaning because it carries so much of our character, so much of our personality, so much of our cultural heritage, and of our familial features, and so much of what makes us who we are. And so I decided to dedicate my entire career in my life to face and neck surgery. So I decided to go and specialize in that area. So I spent 2 additional years in New York City at NYU. I had the chance to learn from some of the experts in the field and to really dedicate myself to understanding and to advancing not just facial transplantation, which was the focus, but also any aspect of facial surgery. So I took that a step further and went and did full training in plastic and reconstructive surgery at Harvard's Massachusetts General Hospital and Brigham Women's Hospital. And during those years, I further dedicated myself to facial aesthetics and to facial reconstruction and to really trying to take these skills from a mere technical procedure to trying to give the patient a level of blended precision and artistry that really would be a result that they would be proud of, a result seamlessly blending with their identity, and something that would give them a timeless change or refinement that they can carry with them through life and through all of their interactions. My vision was and remains to deliver the best care possible and to deliver world-class care in facial rejuvenation.